Pharmacology 2, Unit 3 starts in Chapters 9, 15, and Chapter 20. Defining the medical terminology in each of these chapters on the cardiovascular system, differentiating between cardiac and vascular system drugs, the classification, action, patient teaching, evaluation, the expected outcomes, including the side effects. Perform dosage calculations for drugs related to the cardiac and vascular system medications. Use the nursing process in the administration of the cardiac vascular medications, identifying the routes of the cardiac and vascular medication administration. Identify legal and ethical considerations related to administering these drugs, and evaluate the lab values and their effect on administering the cardiac and vascular system medication. Identify any contraindications in administering these prescribed medications and including over-the-counter medications as well, making sure that you document the client's response to these medications. The primary purpose of the cardiovascular system is to supply oxygenated blood that includes water, plasma, nutrients, and hormones to tissues and organs while removing carbon dioxide and waste products for elimination. Any breakdown in cardiovascular functioning can lead to uncomfortable symptoms, decreased quality of life, and even death if not managed carefully. The cardiovascular system consists of the heart and blood vessels working together to move blood throughout the body. Using specialized cardiac muscle and nerve cells, electrical impulses cause the heart muscle to contract, pumping blood from the heart into the aorta and to the arteries. The oxygenated blood moves through the arteries to the arterioles and then to the capillaries, where oxygen exchanges with carbon dioxide. The deoxygenated blood moves from the capillaries to the venules and then to the larger veins and back to the vena cava, where it returns to the heart. Healthcare providers use a variety of approaches to prevent or manage symptoms and to treat abnormalities in the cardiovascular system. Some drugs work by helping to prevent high cholesterol levels that narrow the arteries, others by reducing high blood pressure, and still others by managing symptoms associated with diseases of the heart itself. This chapter addresses some of the most common cardiovascular drugs that you may see in practice to give you an overview of how these drugs can help provide the best health and quality of life possible for your patients. The discussion proceeds from drugs typically used to reduce the risk of cardiovascular disease to those that treat the cardiovascular disease. Two major risk factors for cardiovascular disease are high levels of blood lipids, also known as hyperlipidemia, and high blood pressure, hypertension. Effective drug therapy can modify both of these risk factors. High levels of blood lipids, including cholesterol, can lead to thickening of the lining of the arteries with fatty plaque, a condition called arteriosclerosis. Eventually, arteriosclerosis blocks some blood flow through the arteries. When high blood pressure coexists with arteriosclerosis, greater amounts of plaque occur with further blood vessel narrowing, and the heart has to work harder to pump blood through them. Decreased blood flow through the coronary arteries that supply the heart muscle with oxygen can result in ischemia, the lack of oxygen to the tissue, and pain called angina. To treat angina, selected cardiovascular drugs can dilate also widen the coronary arteries, which delivers more blood and oxygen to the heart muscle. If the blood flow is severely impaired through the coronary arteries or a clot forms in an artery, the patient can experience a myocardial infarction, which is also known as a heart attack, that results from a severe lack of oxygen to the heart muscle. Over time, the ability of the heart to pump decreases in patients with prolonged high blood pressure and or changes in heart muscle resulting from a myocardial infarction. The decreased ability of the heart to pump effectively is called heart failure. Heart failure is managed by using a variety of cardiovascular drugs to improve the ability of the heart to pump and reduce the associated symptoms. Damage to the heart muscle from high blood pressure and arteriosclerosis causes changes in the electrical conduction system of the heart. These changes can result in dysrhythmia, which is an abnormal heart rhythm. The dysrhythmia can cause significant decreases in cardiac output and even death if not managed effectively. Several cardiovascular drugs are used to restore the normal rhythm of the heart. The cardiovascular drug groups discussed in this chapter include cholesterol-lowering drugs, antihyperlipidemics, blood pressure-lowering drugs, antihypertensives, blood vessel dilators, known as antianginals, drugs to improve heart muscle contraction, positive inotropic drugs, and drugs to make electrical conduction through the heart more regular, antidysrhythmics. A patient may be taking drugs from a variety of cardiovascular drug categories. Hyperlipidemia is the condition of having high levels of lipids, primarily high cholesterol, and other fatty acids in the blood. Antihyperlipidemics are drugs that treat hyperlipidemia, particularly by targeting blood cholesterol levels. The body needs a certain amount of cholesterol for making healthy cell membranes, hormones, vitamin D, and bile acids, and it is a normal and vital part of the blood plasma. The liver produces much of the body's cholesterol. Cholesterol levels in blood are a combination of the cholesterol ingested in the diet and the cholesterol produced by the liver. The liver contributes much more cholesterol to blood cholesterol levels than does the food that you eat. Blood lipids, cholesterol, and other fatty acids move through the body attached to protein carriers called lipoproteins. When considering cardiovascular disease and arteriosclerosis, the most important lipoproteins are the high-density lipoproteins, the HDL, which are protective, and low-density proteins, the LDL, which are harmful. As you think about drugs for reducing cholesterol, you can consider the effect of the drug on the levels of good cholesterol, protective, which is the HDL, and they're higher on the chain, and bad cholesterol, which is the harmful LDL, and they're on the lower level of the chain. HDL remove cholesterol from the blood and transport it to the liver. If you have ever seen a catfish in action, you can see that it acts as a scavenger for food and it cleans the bottom of the fish tank. HDL scavenge harmful lipids from the blood so that they do not stick to blood vessels and contribute to plaque. LDL cholesterols, on the other hand, are major contributors to the onset and progression of heart disease and stroke. For some patients, lipid levels can be improved through diet, exercise, lifestyle changes. Others may require lipid-lowering drugs such as anti-hyperlipidemics. Most lipid-lowering drugs tend to reduce LDL and other fatty acids. Some drugs can increase the scavenger HDLs. There are 4 classes of drugs that are used to treat hyperlipidemia. HMG-CoA reductase inhibitors, also the statin drugs are in this classification. There are selective cholesterol absorption inhibitors. There are fibric acid derivatives and bile acid sequestrants. Niacin or nicotinic acids were once commonly prescribed for hyperlipidemia, but it is rarely used today because its side effects and because it's no longer considered to be effective. The class HMG-CoA reductase inhibitor, this is where the statin drugs are in. You've got atorvastatin, known as Lipitor, pravastatin, known as Pravachol, and simvastatin, which is Zocor. The action of this drug is to lower the blood LDL levels by slowing liver production of cholesterol. They do not remove dietary cholesterol from the blood. The main use of statins is to lower blood LDL levels to reduce the risk of arteriosclerosis, hypertension, heart attack, peripheral artery disease, and stroke. Although other benefits have been described for statins, they are approved only to lower blood cholesterol levels. The nursing implications for HMG-CoA reductase inhibitor drugs, which are the statin drugs. Remind patients to remain on a low cholesterol diet while taking statins because drugs do not reverse high cholesterol diet. Check the drug references for individual statins because some have best effects when taken in the evening and others can be taken without regard to meals for the best effect. Teach the patients to avoid alcohol because drinking alcohol puts stress on the liver. Tell the patients to report severe muscle aches, changes in their urine, or decreased urinary output because statins can cause rhabdomyolysis, a disorder resulting from broken muscle cells that damage the kidneys. Teach the patients that they should avoid grapefruit juice because it interacts with the statins and can cause drug toxicity. Remind patients to keep their follow-up appointments with their healthcare provider, to continue with regular laboratory work because statins can cause liver problems. Monitor patients for signs and symptoms of liver problems, such as nausea, yellowing of the eyes or roof of the mouth, darkened urine, or light-colored stools because these symptoms suggest damage to the liver. Side effects are rare, but some patients experience GI symptoms, including upset stomach, gas, constipation, and stomach cramps. Some patients experience mild muscle or joint aches. If patients experience these symptoms, remind them to contact their healthcare provider rather than stopping the drug. Some of the nursing implications to patient teaching and assessment. Carefully assess the patient's dietary patterns. Even though the patient is taking a drug to decrease cholesterol, it is not a good reason to continue eating foods that are high in saturated fats, such as fatty meats, dried foods, and baked goods made with trans fats, such as donuts and cookies. Review liver function test results in the medical record before giving statins. If you see any abnormalities or have questions, contact the registered nurse, the RN, or the healthcare provider. If you are working in a community setting, it will be important to know whether your female patients are pregnant or planning pregnancy, because statins are very dangerous to the developing fetus. Women must avoid statins while breastfeeding, and other adults assess for any symptoms of impaired liver function. Ask patients about their use of alcohol before starting statin therapy. Heavy use of alcohol contributes to liver problems while taking statins, and patients need to understand this before beginning their therapy. The planning and implementation. While on statin therapy, patients may have scheduled blood lipid levels drawn as ordered by the prescriber. Levels are typically measured every 4 to 12 weeks after beginning statin therapy and after dosage changes to reevaluate the response to the treatment. Patients need to be fasting at least 12 hours before having blood samples drawn for measurement of cholesterol, HDL, LDL, and triglycerides. The timing of statin administration may impact the patient's response. Consult the pharmacist, or a drug reference book is helpful in determining the best time to schedule the administration of a statin drug. Some statins work best when given in the evening. Many can take once a day without regard to any meals, and some may need to be given twice a day. Do not give the drug with grapefruit juice, because that will inhibit the breakdown of the drug, allowing higher drug blood levels that can contribute to toxicity effects. The patient and family teaching. Tell the patient and the family the following. Lifestyle changes such as exercise and low cholesterol diet and good weight management are just as important as taking the statin drugs themselves to help prevent cardiovascular disease. Make note of the recommended best time of day to take your statin drugs and take them at the same time each day. Inform your healthcare provider if you may be pregnant or plan to become pregnant, because statins can cause birth defects. Avoid the grapefruit juice when you are taking statins, because it can cause the drug to accumulate in the blood and increase the risk of toxic effects. If you have any signs of liver problems, such as colored stools, yellowish tinge to your skin or eyes, or dark urine, notify your healthcare provider immediately, because these are indications of adverse drug effects. Expected side effects include headache, stomach upset, and mild achiness. These usually get better within a few weeks after starting the statin drug. A website such as that of the American Heart Association, located at www.heart.org, have resources to help you learn about cholesterol and low cholesterol diets. Expected side effects. The most common side effects of statins are abdominal pain, headache, diarrhea, muscle pain, known as myalgia, and joint discomfort. Other side effects are sore throat and heartburn. Patients with diabetes may experience elevated blood glucose levels. Some adverse effects. The action of statins is in the liver, and the liver function is therefore affected to some degree. Liver failure has been reported, however, can be rare. With higher doses of statins, patients may experience rhabdomyolysis, which is muscle breakdown. This is a very serious condition that can be life-threatening. The signs and symptoms of rhabdomyolysis include general muscle soreness, muscle pain, muscle weakness, stomach pain, and brown, tea-colored urine. The brown urine results from the kidneys trying to filter the products of the muscle breakdown. Ultimately, patients experience kidney failure. Statins are dangerous if used during pregnancy. Cholesterol is important for normal brain development. If taken during pregnancy, statins can lower the cholesterol levels in the fetus, which result in brain deformities. For the same reason, statins are contraindicated in women who are also breastfeeding. The drug interactions, alcohol and acetaminophen, increase the liver toxicity effects of statins. Aspirin and antacids decrease the effectiveness of statins. Grapefruit juice can increase the concentration of statins in the blood and should be avoided to reduce the risk for toxic side effects. The evaluation is to monitor for expected side effects including headache, upset stomach, sore throat, diarrhea. These side effects are typically short-term and get better over time. Check the patient for jaundice. That's the yellowing of the skin, mucous membranes, including the whites or the sclera of the eyes, and for darkening of the urine or clay-colored stools. These are indications of liver toxicity, also known as hepatotoxicity. Patients who exhibit symptoms require liver function tests, reporting any severe muscle aches or signs of liver problems to the RN or healthcare provider immediately. The classification, fibric acid derivatives, known as fibrates. Gemfibrozil and phenylbrate are the preferred drugs among fibric acid derivatives because they are more effective and have fewer adverse effects than some other drugs. Both are highly effective at lowering triglyceride levels and increasing HDL levels, but they have little effect on lowering LDL levels. Gemfibrozil and phenylfibrate are generally well tolerated, but can cause liver toxicity and cholelithiasis, which is gallstones. These drugs are not recommended for patients with a history of gallbladder disease. The nursing implications and patient teaching. The assessment. As with statins, it is important to assess the patient's diet history, including his or her ability to adhere to lifestyle recommendations. These factors are just as important as the drug therapy because no cholesterol-reducing drug cures hyperlipidemia. Assess the patient's liver function test. If there are any abnormal results, notify the RN or the healthcare provider. Assess the patient's use of alcohol because alcohol can increase the risk of damage to the liver. The planning and implementation for patients taking the non-statin antihyperlipidemic drugs that affect absorption of cholesterol from the GI tract. You will likely be giving supplemental doses of vitamin A, D, and K. As for statins, carefully review the proper timing of these drugs in relation to meals. By themselves, selective cholesterol absorption inhibitors can be given without regard to meals. However, they are often combined with statins and their timing would be similar to that of a statin drug. For best results, fibric acid derivatives such as gemfibrozil should be given 30 minutes before the morning and evening meals. Bile acid sequestrants are usually taken 1 or 2 times a day before meals. The drugs come in powder form and must be mixed with water, milk, or juice. Monitor how well the patient is tolerating the drug. If there are any signs of severe GI symptoms such as abdominal pain, severe bloating, or severe constipation, notify the RN or the healthcare provider. Notice that all of the drugs in this classification have an ending that are somewhat familiar. You have clofibrate, also known as atromid/S, fenofibrate, known as pheноglide, fenofibric acid, known as Fibricor, and gemfibrozil, known as Loped. Bile acid sequestrants is a classification here. They increase the secretion of cholesterol and reduce LDL levels. The bile acid sequestrants, such as cholestyramine and cholestyramine, increase excretion of cholesterol and reduce the LDL levels. They do this by forming a solid compound with bile salts, which increase bile loss through the feces or the stool. Normal fat digestion is disturbed, and many patients do not tolerate these drugs because of uncomfortable GI side effects, constipation, bloating, nausea. Bile acid sequestrants are not absorbed and do not have some of the severe systemic adverse effects that other antihyperlipidemic drugs do have. Other drugs taken with bile acid sequestrants may not get absorbed because they act by binding to substance in the intestinal tract. In particular, bile acid sequestrants reduce absorption of fat-soluble vitamins. Fat-soluble vitamins are A, D, E, and K, and the patient may show symptoms of vitamin deficiency, especially if taking the drugs in high doses or for a long time. Watch for bleeding problems that may result from vitamin K deficiency, which affects the clotting cycle. An easy way to remember your fat-soluble vitamins is to remember an acronym. Katie is fat. Katie is spelled K-A-D-E. Katie is fat. That represents an acronym that says Katie is fat, so that you can remember that fat-soluble vitamins are K-A-D-E. Quastrin, also known as cholestyramine, is a bile acid sequestrant. It's true that this is not used for cholesterol lowering However, the side effect of using this drug is constipation. So if you have a patient that has chronic diarrhea and doesn't have a true disease process or a diagnosis that identifies why we have this problem in the patient, a physician may order this particular drug because the side effect is constipation to try and help bulk up the stool for the patient. So we see this frequently prescribed for patients with chronic diarrhea. The patient and family teaching. Tell the patient and family the following. Take the drug at the same time prescribed because timing is important for cholesterol-lowering drugs. Notify the healthcare provider and your pharmacist that you are taking a cholesterol-lowering drug so that they will carefully review drug interactions with other drugs that you are taking. If you have any significant side effects, notify your healthcare provider before you consider stopping the drug. Dosages may be adjusted by your healthcare provider, or you may be switched to a different drug. The drugs do not by themselves cure your high cholesterol problem. Continue making healthy lifestyle choices. The evaluation would have a decrease in LDL and total cholesterol levels. The healthcare provider will order follow-up blood tests and determine the patient's response to cholesterol-lowering therapy. Compare these results with those that were already obtained before the drug was started and to evaluate the drug effectiveness and any changes in the liver function tests as well. You should see an increase in the HDL cholesterol levels, a decrease in triglyceride levels, a slowing in the progression of any coronary artery disease, and a prevention of cardiovascular disease.